London here with Dr. Rana Al-Falaki. You have been a long-time laser user. Maybe you can talk about your experience and how you got involved in laser dentistry.
Yeah, absolutely. So over 12 years now. I was the first periodontist in the UK to start using lasers.
First one in the whole country?
Mm-hmm.
Wow.
First one in the whole country. And as you know, I am now a global pioneer for the use of lasers in periodontics, so
Yes.
as a specialist. My story actually was after I got the laser, I wanted to send it back. And I think it's really important to say that because there is a learning curve, but if you get past that little stumble, where you think, is it possible, isn't it? How can I incorporate it into my practice? If you actually get past that, it really does change your life in so many ways, both from a clinical point of view, the things you can offer your patients, clinical procedures that you never would have dreamt of offering in practice, your confidence level, the network that you deal with. You become this laser dentist and you mix with people who are like-minded and forward-thinking and innovative. Needless to say, the benefits to your practice with the ROI that you get, and it just changes you. So my journey was a little bit of a stumbling block to start with, and a lot of that was because I was a specialist, and therefore for us as periodontists, we are always looking at the science.
Yes.
And we didn't have the science in those days.
Yeah, certainly a lot less back then than you do now, right?
Yeah, absolutely. And now we have studies. We have studies that say what we were telling people before. We have studies that say the patient journey is better. Patients do experience less pain. This is an alternative to surgery. This
all
will
the patient-reported outcomes.
Just as good results, exactly, with better patient-reported outcomes. So we have that now. So it's no longer hearsay. We can back it up with science, which we couldn't in those days. So my journey has been having fun, innovating, producing protocols which are reproducible so that everyone can get those results. Like I said, I've ended up meeting people and making friends all over the world through the life of lasers. I've been involved in research. My practice went sky high. I mean, I sold it in the end, but it was thanks to lasers that it increased the influx of patients and referrals of dentists as well. So I will never look back, and I continue to enjoy.
You know, we talk to a lot of general practitioners who refer out to periodontists. So how do you see, what's your view of the GP's role in dealing with periodontal disease and the specialist's role?
Absolutely. Well, even as a specialist, I haven't raised a flat for pockets for 10 years. So a couple of years in, once I perfected the protocol. So, but we still get the kind of the satisfaction of surgery with a bit of blood if we want it, surgeon, all the way. But it's minimally invasive, so it's so much kinder to the patient. But I obviously teach courses to general practitioners and specialists, and so the differentiation is in general practice. There is absolutely no reason why you cannot look after your patients, and without maintaining disease, but by actually truly treating the disease effectively and eliminating it successfully. And then the transition to the periodontist could perhaps be just the odd pocket that maybe you're not getting resolution on, or if you're not confident with root coverage procedures or particular peri-implantitis procedures, if they're not working for you in a minimally invasive way, and then you want to refer for the surgical skills. That's where I see the transition. But your patient, of which 80% of people have some degree of periodontal disease, and it's a killer. We now the society
systemic link to many things.
It is an indicator for early death. It's so important to be able to treat that in general practice. And with the use of lasers, as I've seen with many of my students, it has transformed how they do things and what they're able to do for their patients.
Well, that's great, and thank you so much for being part of the BioLace family for so many years. Very impressive.
It's a pleasure. Thank you.